Are you spending too much time explaining surgery, yet some patients still tell you that they felt unprepared? Have you felt pressured to operate even when surgery couldn't meet the patient's goals? Despite a great clinical outcome, have you had a patient say, "If I knew surgery would be like this, I never would have done it"? If this sounds familiar, you are not alone. I'm Gretchen Schwarzy, and this is Better Conversations. With Better Conversations, patients will be more certain about their treatment choices and more prepared for surgery. You can focus your limited time on the patient's priorities. Better Conversations shifts the paradigm for informed consent and shared decision-making. There are 5 steps. 1. Show your cards. 2. Identify the goal. 3. Present all the downsides. 4. Deliberate. And 5. Make a plan. Step 1. Show your cards. Start by stating your initial thoughts about surgery. This is a way to be transparent, so patients don't need to guess what you are thinking. This is not a recommendation. It is your initial opinion of what might be best for them. You might say, "I think surgery can help you," or "I'm worried surgery is not a good idea." When there are 2 reasonable treatment options, you can say, "I'm on the fence. There are 2 ways to treat this." Step 2. Identify the goal. Surgery can accomplish only 4 goals: help patients live longer, feel better, preserve function, or make a diagnosis. Patients often develop their own ideas about what surgery can do for them, which might not be plausible. When you explicitly name at least one of the 4 goals, everyone will have the same understanding of what surgery can and cannot accomplish. For a patient with varicose veins, you might say, "Varicose veins won't shorten your life or lead to amputation. The goal of surgery is to help your legs feel better." Likewise, you can use this approach when you worry surgery will produce more harm than good. For a sick patient with a 6-centimeter aneurysm, you could say, "When we do this surgery, we do it to help people live longer. Given what I know about your other health problems, I'm worried surgery won't extend your life." Step 3. Present all the downsides of surgery. Surgeons are taught to describe risks and complications, but there are more downsides to surgery than just a list of risks. I like to remember it this way. The bin of bad stuff has 3 layers. There are bad things that happen to everyone who has surgery. There are bad things that could happen, and sometimes we fall short. Let's look at layer 1. Everyone who has surgery will need to get through it. This includes pain, time, and effort to recover. Consider a patient with colon cancer having a laparoscopic colectomy. Tell them the story about what it is like to have surgery. You might say, "You'll need a short time in the hospital. You will feel tired and sore for a few weeks, and it will probably take several weeks to feel like yourself again." Remember, even small incisions hurt, and recovering from minor surgery takes time. Major operations are painful, take months for recovery, and some operations leave patients with permanent changes. These aren't risks or things that might happen. These are things that happen to everyone who has this surgery. Next is layer 2, bad things that could happen. These range from small problems to serious complications and permanent functional changes. For our patient with colon cancer, talk about bumps in the road, like shoulder pain and difficulty urinating. The chance of a more serious complication, like anastomotic leak and dangerous infections, or permanent functional changes, like chronic loose stools. There are also things you cannot predict but arise because the patient had surgery. You could say, "Every time I operate on someone, I know they are vulnerable to things that can happen in the operating room or the hospital. like a drug reaction or a numb spot from positioning. While you can't name all the possibilities, giving examples will help patients see the trade-offs. Finally, layer 3. We fall short. Even when surgery goes well, we can still fall short of our goals. Their cancer comes back, and their life is shorter than we hoped. Or they still have pain. Despite all our efforts, we didn't reach the goal. Patients need to hear these things to visualize the give and take between their goals and the downsides in advance. Patients who experience a major unwanted change postoperatively, like chronic loose stools, may believe this is worth it to achieve a goal like life prolongation, but it is easier to tolerate unwanted outcomes when they appreciate the trade-offs in advance. Step 4, deliberate. Better conversations helps patients consider what they might gain and lose with surgery. To support deliberation, you might ask, "What do you think?" When you are inclined to operate, you might say, "Is it worth it to you?" If you are reluctant to operate, you could say, "Does my reasoning make sense to you?" When there are 2 reasonable options, you can coach patients to compare the downsides or consider how they prioritize different goals. Promoting deliberation helps patients reflect on what they've learned and talk about how they see the trade-offs. Step 5, make a plan. When the goals of surgery are valuable and the downsides of surgery are tolerable, patients will likely judge surgery as worthwhile, even if unwanted outcomes occur. Some patients will judge the goal of surgery as not valuable or feel that the treatment burdens are too high, even when surgery is what is usually done. When the surgeon is reluctant to operate, patients might disagree, believing the downsides are not too great. This presents an opportunity to support patients by agreeing to disagree, acknowledging uncertainty about what will make the patient better off. Once surgery is the agreed-upon plan, some patients may want to engage with the technical details of the operation. This can satisfy their curiosity or further generate rapport, but it is not required for being informed. Let's summarize. You haven't done better conversations unless you have done the following. Show your cards. Provide context about whether you think surgery is a good idea. Describe at least one goal of surgery. Will surgery help the patient live longer, feel better, preserve function, or make a diagnosis? Comprehensively discuss all 3 layers of the downsides. Remember to include the bad things that happen to everyone who has surgery, the bad things that could happen, and that we could fall short. Help patients deliberate about the goals in comparison to the downsides. Ask them, is it worth it? Does my reasoning make sense to you? Make an agreement and a plan. Confirm you agree with the next steps for treatment and reiterate their reasoning for moving forward this way. Many surgeons will hear about better conversations and say, "I already do that." I challenge you to try it this way. Although it sounds simple, it takes practice and some adapting to change the way you talk to patients about surgery. Want to learn more?